I want to appreciate our government and all health professions, and as well as community health workers, for making all effort to save more life of the community members from succumb to COVID-19.
I want to thank Honorable Kalumbi Shangula and his team for the 2 mammograms which were procured, allowing for the screening and detection of breast cancers at an early stage so that treatment can be initiated.
I want to thank the Ministry of Health and Social Service for the decentralized its function to the regional government.
Let me applaud or thank you for approving the structure of Kaenda Clinic. This clinic was built in a form that it even suits to be a health center.
I want to thank the Ministry of Health to complete the clinic in Epupa, which abandoned by those who want to milk the government money and leave the work halfway.
Kavango West Region appreciate the ministry's intervention to complete the construction of Kurenkuru Primary Health Care, which was abandoned for some time. On behalf of the region, I will again to thank the Minister of Health and Social Service, Dr. Kalumbi Shangula, who visited Garuha Clinic. Among his busy schedule, his visit resulted in the reopening of one part of Garuha Clinic.
The National Council MPs highlighted several challenges that the government needs to address.
Within this current financial year, the ministry should consider to procure new ambulance and the new vehicle for the outreach clinic.
It is the renovation of some of our clinics and hospitals. Really, if we move around, we observe that some of our hospitals and clinics, the crack which is there, you can stand here, you see the nurse inside while we are outside.
Our hospital, especially in Opuo, is in need of wheelchairs for children and for adults.
Our greatest problem is aging equipment. I think if we can just move to the point where we look a little bit better on the maintenance and the upkeep, etc., then I think we will go a long way with what we have.
Patient-nurses ratio is another problem again. We are calling for the ministry to, at least with this budget, to employ more staff so that at least there should be more nurses in the region and across the country.
One of the challenges experienced by residents is walking long distance to access the health services.
CT scan machines are needed in intermediate hospital. In addition to that, the community health workers are especially region with a vast remote, they are very needed there.
Lack of equipments ranging from chairs and tables, BP machines, heaters, and incubators in maternity wards, no warm place for keeping newborn babies in one area that is even exposed, or one incubator, thus putting these newborn babies to a risk of cross-infection and sepsis.
MPs have also called on government to consider employing community extension health workers who helped health professionals and community members during the COVID-19 pandemic. They have also requested that rural clinics operate on weekends and build more facilities that are accessible by people with disabilities. The Ministry of Health and Social Services has been allocated 9,684,890,000 for the 2023-2024 financial year. Serafia Nadunya, NBC News, Windhoek.